Welcome to Health Professional Radio. So glad that you could join us for another segment. I'm your host, Neil Howard. And in this segment, we're going to be speaking with Trish Richardson. She's joining us here as Director of Post-Acute Care Solutions at Relias, the healthcare training and performance solutions company. She's going to talk about some recently announced nursing home reforms and some steps that nurses and post-acute care facilities can take to address some of the new requirements around nurse competencies and the intensified scrutiny around issues such as abuse or neglect, infection control. And welcome to Health Professional Radio, Trish Richardson. Thank you for joining us.
Oh, absolutely, Neil. I'm happy to be here, and I wish we could be in person, but happy to be a part of the conversation today.
I'm glad that you took the time out. Director of Post-Acute Care Solutions at Relias, give us a brief look into your professional background and talk about Relias' mission.
Oh, absolutely. So for me personally, I have been in business and in healthcare for about 30 years. I actually started out as a stockbroker 30 years ago. I am a board-certified nurse executive. I'm also a certified medical surgical registered nurse, and I'm also the current president-elect of the North Carolina Nurses Association. My work at Relias, I am the director of Post-Acute Care Solutions. For us, what we do is I provide and establish and advance the strategic vision for the Post-Acute Care Solutions practice. I offer executive clinical counsel and strategic guidance for key renewals and prospects and consulting engagements. But I also work, and I'm really passionate about this work as well, to work and design and deliver individualized client and vertical-specific consulting solutions for us at Relias. And our solutions practice is a pretty new offering. We've been around for about a year and a half. I'm really excited about the work that we are doing here. And our mission is to serve those in our community to the fullest extent, and I'm very passionate about serving every client that we interact with, and also the millions of caregivers that we interact with as well, providing them with essential education and training, and also helping them advance their own professional development.
Now, we've all been hearing about a severe shortage of nurses, other healthcare practitioners as well, but nurses in particular, the backbone, as far as I'm concerned, of the healthcare industry. This shortage is causing lots and lots of problems, especially exacerbating the problem of acute care, nursing home facilities, how these patients are cared for. Talk about how Relias is moving forward to help retain your employees as well as improve the staff retention in other facilities as well.
Absolutely. What a great question. So one of the things that we offer at Relias, it's a comprehensive learning management system, right? And I talk to clients all the time and say, we actually have a competitive advantage. And we have a competitive advantage for our clients in all verticals, acute and post-acute HHS. What I like to call this meal is like regulatory peace of mind with a CE wrapper. So we literally have thousands of modules that offer continuing education. And I think of it from a nursing perspective, right? We're in the driver's seat. We are absolutely in the driver's seat today. And we want opportunities for professional growth and development and engagement. And one of the things that we like to talk about at Relias is that offering of on-demand professional development and individualized career pathing. You know, our clients, their clinicians can go on to our website and they can access, go onto their learning management system, and they can access this content in an area that they're curious about. You know, maybe they want to get to know more about a specific area of critical care. They can go into the libraries and learn more about that, and also get that continuing education that is essential for recertifying and getting our licenses renewed. But also we talk with our clients about the engagement piece and working with clients on opportunities for learning and development and ongoing professional learning, designing, for example, a senior CNA program, you know, helping nurse assistants to really feel a part of that culture, to empower them. We look at nurses, you know, my colleagues in the field, they're taking these roles of leadership in management and education earlier and earlier in their career. So what we offer as well is opportunities to consult with our clients to design maybe an early career transition to practice nurse, or we have an opportunity for nurses who are becoming managers. What does that mean? What does that look like? We have a lot of content, incredible content in our library to support that, so that we can not only encourage recruitment and retention, but also engagement. And then with all of that said, your care quality improves as well. Your passion, your nurses look to each other and they're engaged and they're impassioned and empowered in their work. And it all comes through in those patient and resident experiences as well.
With the empowerment and the passion also comes a lot of added responsibility, especially now. Nurses aren't only in the hospital setting, they're not only in the clinic setting, they're in the home healthcare setting, they're in the nursing home setting, and especially with the Biden administration currently being focused on nursing homes. How do you think this is going to impact the nursing industry as far as burnout is concerned?
Oh, what a great question. Such a great question. And burnout has been top of mind for so many years, but especially now. You're absolutely right, Neil, in this environment. And I've talked to some of the nurses and my colleagues, and I've actually been on the front lines as a volunteer with the state of North Carolina in the nursing homes and at the vaccination sites, and just talking with everybody. And they are exhausted. They're absolutely exhausted. Some of those areas that they would like to see more from their employers is that opportunity for growth and development and a personalized approach. I can tell you, Neil, and having been on the other side, there's a time and a place for pizza. Like nurses have said, we don't want any more pizza. We're good. We want to feel a part of the organization. We want to feel that our voices matter. We want to feel that we have what I like to call their clinical decisions made every day at the bedside. They do have financial impacts. And so they want to feel a part of those decisions. They want to be heard at the table. They want to be valued and not just someone who comes to work, clocks in and clocks out at the end of the shift. And to do that, it's really for executives to look in and say, what can I do to help empower this workforce, to help them want to stay? Some clients that we're talking with and what I've seen in the industry is that some of these organizations are actually leaning into their staff and asking them, why are you staying? We're so happy you're here. Tell us why you made the decision to stay. So that's an approach that we can take going forward, but also just helping our nurses to understand that the work that you do every day is so meaningful, and having been there on the front lines for so many years, it is significant that we continue to lean into our nurses from an organization's perspective, find out their passions and find out what their whys are and capitalize on that. Celebrate that and celebrate them to remain engaged and empowered and help them to stay with those organizations.
Are all of your services geared toward retention and upskilling, or are some of them geared toward just simply listening to nurses vent, not necessarily about what they're happy about, but about what they're unhappy about, maybe even if they don't expect change?
Oh, that's another great question. So we have multiple initiatives that we are working through, and I can confidently speak on what Relias is doing. Again, is recruitment, retention, engagement. We think about, survey preparedness, which is incredibly important on the everyday. I like to say that we do not want to just teach to a test. We want to help our clients and their clinicians at the bedside and in the homes to be survey ready every day and live the example of emergency preparedness, focusing on care quality outcomes, focusing on infection control and prevention, and understanding that, when you increase the staff preparedness at the baseline, right, you increase the safety of the care environment, which increases care quality and improves overall survey readiness. And in the end, improves the financial stability of healthcare organizations. But also we have we have a lot of work that we are doing around nurse.com, and that is something that we are very proud of. But we do have that area where nurses can come on that website and join that environment, and they can also access, whether they're a Relias client or not, nurses can go on to nurse.com and they can see that they can join and actually have opportunities for continuing education there as well. And so it's very important for us to stay uniquely focused on the needs of our clients, and not only, again, recruitment, retention, and all the things we mentioned, but really leaning in and proactively listening. And some of the work that we do in consulting is we get to know that staff. I'm on conversations every week with, chief nursing officers, chief clinical officers, finance officers, and nursing directors and managers, and really listening to what they're hearing and what they're saying. Also, with my work with the North Carolina Nurses Association, we hear from nurses across the state and around the country the things that they need as well. So we want to, as Relias, keep our ear to the ground, focus on our clients, leaning in proactively to address their needs and bringing them real solutions that will bring tangible impacts to their organizations.
Give us a website where we can learn much more about Relias, if you would.
Absolutely. It's very, very easy. Relias.com.
Great. Trish, been a pleasure speaking with you.
Yeah.
Thank you so much for taking this time this morning. And hopefully we'll get an opportunity to speak again and talk much more about nurse retention and upskilling. Thank you.
Absolutely. Thank you, Neil, so much. It's been great to speak with you today.
You as well. You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Trish Richardson, Director of Post-Acute Care Solutions at Relias. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.